Good morning and welcome to the Division of Allergy and Infectious Diseases at University of Washington. The vision of this division is to provide outstanding care to patients, to develop research in unique and emerging areas, to encourage clinical excellence, to provide outstanding clinical training, and to provide excellent administrative services to facilitate these stellar accomplishments. We are one of the largest ID divisions in the country, and we have the highest amount of grant funding among divisions in public universities. We are also the strongest research division at the University of Washington Department of Medicine. Our total budget currently is about $50 million annually in research funds. But if you look at affiliated groups that we often work with, such as Department of Global Health, our funding is about $350 million per year. We have over 120 faculty. Every time I count, it's more. And we have a good gender balance at all ranks. The focus areas in our division is STDs and HIV. Probably historically, we're most known by that, but also by infections in immunocompromised hosts, as Fred Hutch, which is an affiliated institution, is the place where first bone marrow transplants were done, and it's still an outstanding transplant center. We have one of the largest virology divisions in the country, with a very large menu of pathogens that you can identify using PCR. We have an excellent immunology program. There's a lot of work being done in vaccine development, including for COVID. There's also a lot of work being done in parasitology drug development. There's increasing effort in microbiome in both health and disease, and that's both at the Fred Hutch as well as at the university. And we're also well known for implementation science. What is a little bit unusual, perhaps, about this institution are the very wide interdisciplinary collaborations that we have between both departments, divisions, and even the institutions that we work with. I know that you hear that grant success rate overall is pretty low. Sometimes people give single digits numbers. This is not true here. So faculty who are here have a much higher success rate, about 30 to 40%. And I added here because since this spring we have already obtained more than $10 million in funding for COVID-related activities. And for my division, we have had more than 50 peer-reviewed manuscripts that have been published. Our fellowship program is supported by 3 NIH training grants that support the fellows during their research years. 2 of them are long-standing. As you can see, we've had the host defense since 1976, STD HIV since 1977. Transplant is our newest training grant. We've had it for 3 years, but so far it actually has been highlighted as one of the very successful new programs at NIH. As a result, over 80% of our graduates have careers in research, most of them in academia, but many also go into public health, and some go into pharmaceutical industry. But they all count as being in research. And we have graduates that are based all over the USA, as well as globally, although in the current climate, many of them have come closer to home. This is a slide made by Dr. King Holmes, who you can see is in the middle. He has just recently retired. And these are the many, many generations of his trainees that have resulted from him starting such an excellent infectious disease program with a focus on STDs at the University of Washington. This is already an old slide, and we could probably add another 1 or 2 generations to this at the current point. We have a diverse and welcoming faculty. We have a long tradition of faculty who really pay a lot of attention to fellows. Fellowship is very important in our division. And people engage in all sorts of interesting activities, some of them athletic, some of them less athletic, but you can see some of them presented here. We also have a lot of emphasis on clinical and teaching excellence, aside from the research excellence. The infectious diseases actually provides staffs year-round a general medicine service. We are the only subspecialty that does that. We also have outstanding HIV clinics with a lot of emphasis on teaching. Faculty in this division teach regular courses at the School of Medicine, both in human biology and also in infectious diseases as a very popular clinical elective. We are affiliated with one of the best schools of public health that has a lot of specialties that are listed here, and many of us have dual appointments, both at the School of Medicine and at the School of Public Health, and teach regular courses for graduate students at the School of Public Health as well. We have also been leaders in the clinician scholars advancement and have developed both methods and standards for distance learning and for capacity building in global health and rural areas. And I hope that you will hear about some of those programs today throughout the We work collaboratively with hospitals in antimicrobial stewardship, infection control, and these are many of the areas where fellows have interest and want to learn how to do, and we will be happy to teach you how to do it. We also have fellows that come in and want to become expert in transplant infections, whether stem cell or solid organ. We have general ID clinics and HIV clinics. One of the largest clinics in the Pacific Northwest for HIV patients is here and has been here for many, many, many years. We also have and have had for quite a while hepatitis clinic and Project ECHO, which actually teaches clinicians that are not here how to take care of patients in their community via telelearning. The one program I wanted to highlight is Tele-Antimicrobial Stewardship, or TASP. This is a program that has been set up by John Lynch and Paul Pottinger and Chloe Bryson-Kahn, who is here, is very active in it as well, with a lot of help from the others. And this is a program to empower small hospitals who may not have their own antimicrobial stewardship programs or infectious disease physicians to develop such programs, often with the help of the local pharmacists. So this consists of weekly meetings that both have a didactic component as well as specific case consultations. And what's been interesting to watch is how these hospitals begin to develop a relationship amongst themselves as well, not only with the faculty here. And we now have, last time I asked, we had over 50 paying customers in the Western Washington area. The other program I wanted to highlight that has been really started by Bob Harrington and Nina Kim is the AID Research Collaboratory, which leverages electronic medical records to do research. And this is sort of the pipeline of how we do it. And we have a full-time biostatistician who works supporting these efforts with Nina. And here you can see some of the projects that are either have been published or are currently on the way that are using this approach. And you can see all the ones on the right are actually, almost all of them are focused on COVID. So once COVID started, we have been very busy trying to learn as much as we can about it using electronic We have beautiful space on a lot of the campus. The campus is spread out across the city, but both South Lake Union, which is where the laboratories are, have new buildings, as well as the building I'm in, and JP at Harborview is only about just over 10 years old. However, I wanted to not be completely Pollyannish, and I do want to say that we are a state university. We have limited resources. As you know, in this country, healthcare is highly problematic, and we have a lot of bureaucratic complexities that perhaps in some private institutions you would not see. I think some of this, however, is offset by people's commitment here to deliver the best healthcare that we can. And I always actually found this graph really fascinating. This is from the New York Times, and it shows you the proportion of each specialty by party affiliation. And as you can see at the very bottom, we have infectious diseases. So we are actually in the specialty that is most involved in, I think, social problems in this country. We're very committed to diversity, and we've actually been very active during the recent years around those areas, and I'm sure that the fellows and other people can tell you more about it during your visit here. So we plan to continue to be excellent in these areas, and I think we've responded well to the COVID challenge, and will as well to future ones. We will continue to be very collaborative with global health. We have many other collaborations here that we continue to foster. And of course, we need to evolve in research to match evolving microbes. So welcome. I hope you have a good day, and please reach out to me if you have more questions.